If you get this video, that means you had a visit with one of our neurologists or one of our neurosurgeons here at UT Health, and I'm sure you got overloaded with information. We wanted to use this video as a way that you could recap the visit so that you know what needs to be done after your visit with your physician. So there's a couple of different orders or requests or appointments that your doctor likely asked you to have done. And you might be at home now wondering, what was that I was supposed to do? So we have a phone number here at the office, and we'd love for you to call with any questions you have. That phone number is 713-486-8000. Another great way to find out information about your appointment is to use the Epic patient portal. We can put a little link that you can follow to register if you haven't registered already. But the Epic patient portal is a great way to message your provider directly with questions that you might have, look up tests that were ordered, labs that were ordered, referrals that might have been sent to other physicians. So we really encourage you to sign up for the portal so that you can keep up to date with all of your care. So first off, your provider likely needed to get some diagnostics done to learn more about your issue. In a lot of cases, this requires imaging. So they might have asked you to do a CT scan or an MRI. These tests will be done typically at Memorial Hermann. So if you have a more invasive type procedure or you have an implanted medical device, then your imaging will probably have to be done at Memorial Hermann Hospital. And so if that's the case, you would call 877-704-8700 to schedule that test. If you do not have any implanted medical devices and your imaging is something straightforward like an MRI or CT, then you can call our outpatient imaging center at 713-512-6040 to schedule. Probably 80% of the cases, once you finish your imaging, then the doctor probably wants to see you back so that he can go over those results with you, formulate a diagnosis, and then a plan of care. In some other cases, your doctor may have asked you to complete labs. You can either access those lab orders through the patient portal. You can call the office and have us send you a copy, but in most cases, those labs are sent directly to Memorial Hermann, and they should have them available when you call to schedule. And for labs, you can call to schedule the same number that I referenced before, the 877-704-8700. But in a lot of cases, since the labs are fairly quick, you don't need an appointment. You can just stop by and they can do the labs for you. In other cases, the physician that you saw today may want to collaborate your care with another physician who either may be more experienced or needs to take part of your care. And in those cases, we send a referral to that other physician, and that office, once they receive the referral, they'll call you to make an appointment. If you don't receive a call from that other physician's office within a week, then please call our office so that we can help facilitate that visit. If you have questions about the doctor who the referral was sent to, if you access your patient portal, you can look it up in referrals. You should be able to find that physician's name in there if you're curious about who else you're supposed to see, or if you want to just take the initiative and call their office to make an appointment. In other cases, some of these doctors may be prescribing you medications. These medications are all electronically sent to the pharmacy phone number that we have on file. And if you have questions about the medication, again, you can call us or access the patient portal, and it'll have all of your currently active medications or new orders that were placed for medications easily accessible there. We understand here at UT Health that you have many other options for your care, and we're happy that you came to us. And so I hope that you'll continue to openly contact us if you need any help or if you have any other questions.